caucus in the country are demanding the government to increase budgetary allocation to health towards the realization of the 15% baseline envisioned by the Abuja Declaration of 2001. Speaking in Nairobi on the state of health sector in the country after 10 years of devolution, the healthcare workers stated that since the inception of devolution, health service delivery has been greatly compromised by the shortage of health workers and unavailability of essential supplies and equipment. As Kennedy Kimani now reports, the health workers want the Kenya Kwanza government to develop a strategy for annual recruitment of health workers as a matter of priority.
While giving their address on the state of healthcare in the country after 10 years of devolution, the Healthcare Workers Caucus are now demanding the government to increase the budgetary allocation to health and develop a strategy for annual recruitment of health workers.
In the next 40 days, and by that I mean by 5th of November, if we have any county that shall have not paid the workers, the healthcare workers, their salaries and have not remitted salary reduction, then we will not at that particular time sympathize with the government. But we will ask those workers not to be at work and to wait until all those salary reductions are done.
Since the inception of devolution, the healthcare workers state that health service delivery has been greatly compromised by the shortage of healthcare workers and unavailability of essential supplies and equipment.
There has been acute shortage of health workers that has been occasioned by lack of employment and a structured policy which is actually orchestrated by inadequate financing and government goodwill.
The health workers also want the Kenya Kwanza government to consider the formation of a joint task force on health, development of a strategy for effective human resource for health management, immediate resumption of collective bargaining agreement negotiations, and embracing social dialogue as a matter of priority.
So we are asking for a paradigm shift in the way that we do things. It is embarrassing that to date we are still having some counties that are going on strike because people have not been paid on time. Some counties like Meru, people have not even been paid the salary for August, and we are heading to end of September. And that is something that runs across so many counties across the country.
With the new government in place, health workers want health to be given its due priority, as they say much more needs to be done if the country is to achieve the universal healthcare agenda. Kennedy Kimani, Hope TV Newswatch, Nairobi.